Meet Norman. Norman is one of our SimMan 3G mannequins. He is a high-fidelity patient simulator with realistic anatomical landmarks and is controlled remotely by an operator in one of our control rooms. As you would expect in a clinical setting, Norman has a touchscreen patient monitor that could display vital signs including blood pressure monitoring, ECG, and saturations. It is made available during patient simulation to monitor and observe changes in the patient's clinical status. Norman can also be used with other equipment found in a variety of healthcare settings. Norman is capable of bilateral and unilateral chest rise and fall. He has a broad variety of breathing sounds. These normal and abnormal breath sounds can be auscultated in the locations indicated by the blue dots. Essential basic airway skills, such as bag mask ventilation and oral airway insertion, can be performed. Norman is anatomically correct for the insertion of advanced supraglottic and endotracheal devices, as well as surgical techniques including cricothyrotomy, bilateral needle decompression, and chest tube insertion. As with a real patient, central cyanosis can be noted with low saturation levels. Norman has central and peripheral pulses bilaterally. With the exception of the right brachial, you'll find pulses wherever you would expect to find them on your patient. The pulses are synchronized with ECG, and the strengths are variable with blood pressure. Remember, as blood pressure decreases, pulses will weaken. The heart sounds can be auscultated from 4 different locations identified by red dots. A defibrillator can be used to monitor, cardiovert, pace, and shock with specially adapted pads. An AED can also be used. There are 2 contacts for attaching these pads to the mannequin that enables you to deliver the appropriate dose of energy. As we know, quality of CPR is very important for patient survival. When performing chest compressions, treat Norman with the same depth, release, rate, and position you would on a real human. SimMan 3G has IO sites on his left tibia and upper sternum. An in situ IV is located in his right AC, where fluids and medications can be administered. As urine output is an important aspect of managing real patients, Norman is capable of producing urine at a variable rate. A Foley catheter can be inserted in both male and female genitalia to allow for collection and measurement of output. Stomach distension can also be simulated with bowel sounds available in all 4 quadrants. In addition, a nasogastric tube can be inserted. In order to assess the neurological state of Norman, his eyes can be open and blinking or stay closed. His pupils can also react to light or remain constricted or dilated. 2 other important neurological features are Norman's ability to have seizures as well as to speak.
Doc, I feel like I could die.
Norman has the ability to sweat and cry, secrete fluids from his eyes, ears, nose, and mouth, and actively bleed from his wounds. For increased realism, stage makeup can be applied to simulate or enhance injury or illness. Last but not least, challenge yourself and have fun.